Question 1. A clinical mental health counselor is working with a 32-year-old client experiencing significant anxiety following a recent job loss. The client reports recurrent intrusive thoughts about financial ruin, difficulty sleeping, and persistent worry that she will never find another job. She often feels restless and has trouble concentrating. These symptoms have been present for the past 3 months and are causing marked distress and impairment in her daily functioning. Which of the following DSM-5-TR diagnoses is most appropriate for this client's presentation? A. Panic disorder. B. Generalized anxiety disorder. C. Adjustment disorder with anxiety. D. Social anxiety disorder. Answer: B. Generalized anxiety disorder. This question tests your ability to apply DSM-5-TR diagnostic criteria, focusing on anxiety disorders. The keywords recurrent intrusive thoughts, persistent worry, difficulty sleeping, restless, trouble concentrating, and symptoms present for 3 months point directly to generalized anxiety disorder, which requires excessive anxiety and worry occurring more days than not for at least 6 months, accompanied by at least 3 specific symptoms, e.g., restlessness, difficulty concentrating, sleep disturbance. While the duration specified is 3 months, in a real clinical scenario, a counselor would continue to monitor. However, among the given choices, generalized anxiety disorder most accurately captures the pervasive, ongoing worry about multiple areas of life, such as financial ruin and future employment, without a specific trigger or situational focus characteristic of the other disorders listed. For example, adjustment disorder with anxiety would be a reaction to a specific stressor, but the pervasive nature here extends beyond typical adjustment. Remember, GAD is about widespread, persistent worry, not specific triggers or situations. Question 2. A counselor is facilitating a psychoeducational group for adolescents on coping skills. During a session, one group member consistently dominates the discussion, interrupts others, and offers unsolicited advice, leading to frustration among other participants. What is the most appropriate initial action for the counselor to take? A. Directly confront the dominating member about their behavior in front of the group. B. Ignore the behavior, hoping the group dynamics will self-correct over time. C. Remind the group about the established ground rules for participation and turn-taking. D. Assign a specific role to the dominating member, such as note-taker, to redirect their energy. Answer: C. Remind the group about the established ground rules for participation and turn-taking. This question evaluates your understanding of group dynamics and appropriate counselor interventions, particularly in the early stages of addressing disruptive behavior. The keywords consistently dominates, interrupts others, and frustration among other participants highlight a need for intervention. The most appropriate initial step is to gently remind the group of the established ground rules, which serves to address the behavior indirectly, protect group cohesion, and reinforce norms without shaming an individual member. For instance, you might say, let's remember our guideline about giving everyone a chance to speak and listening respectfully. This approach maintains a supportive environment while encouraging all members to adhere to expectations. Always start with a gentle, group-focused reminder before moving to more direct individual interventions. Question 3. A 45-year-old male client, Mr. Henderson, presents for counseling reporting feelings of hopelessness, significant weight loss, early morning awakenings, and a pervasive lack of interest in previously enjoyable activities. He mentions these symptoms began approximately 5 weeks ago after his adult daughter moved away for college. Which diagnostic specifier would be most important to consider in this case, given the symptom presentation? A. With anxious distress. B. With melancholic features. C. With atypical features. D. with peripartum onset. Answer B. With melancholic features. This question assesses your knowledge of major depressive disorder specifiers in the DSM-5-TR, requiring careful attention to specific symptom constellations. The keywords hopelessness, significant weight loss, early morning awakenings, and pervasive lack of interest in previously enjoyable activities, anhedonia, are classic indicators of melancholic features, which is a severe form of depression often characterized by profound anhedonia, psychomotor agitation or retardation, early morning awakening, and significant appetite/weight changes. While other specifiers might seem plausible, the constellation of distinct physiological symptoms points strongly to melancholia. For example, if he had increased appetite or hypersomnia, atypical features might be considered. The takeaway is to meticulously match the client's symptom profile to the specific diagnostic criteria and specifiers to ensure accurate diagnosis. Question 4. A counselor is providing services to a client who has expressed suicidal ideation with a specific plan and access to means. The client has explicitly requested that the counselor keep this information confidential, citing fear of hospitalization and judgment. What is the counselor's primary ethical and legal responsibility in this situation? A. Maintain confidentiality as per the client's request to preserve the therapeutic relationship. B. Consult with a supervisor, but ultimately respect the client's autonomy and decision. C. Initiate a duty to warn and protect by contacting appropriate third parties or emergency services. D. Focus on de-escalating the client's immediate distress and negotiating a safety contract without involving others. Answer C. Initiate a duty to warn and protect by contacting appropriate third parties or emergency services. This question targets a critical ethical and legal dilemma involving client confidentiality versus the duty to protect, a cornerstone of counseling ethics. The keywords suicidal ideation with a specific plan and access to means immediately trigger the counselor's duty to warn and protect. In cases where a client poses a clear and imminent danger to themselves or others, confidentiality must be breached to ensure safety, superseding the client's request for secrecy. For example, this would involve contacting emergency services, a designated crisis team, or relevant family members to ensure the client receives immediate intervention. Always prioritize safety above all else when there is an imminent risk of harm. It's a non-negotiable ethical and legal imperative. Question 5. In a family counseling session, a therapist observes a pattern where the parents consistently argue about minor issues, and whenever this occurs, their adolescent child begins to act out aggressively. The aggression then temporarily shifts the parents' focus from their conflict to managing the child's behavior. A family systems therapist would most likely conceptualize the child's behavior as serving which function? A. An attempt to gain attention from neglectful parents. B. A symptom of an underlying individual disorder requiring medication. C. A way to triangulate the parents and diffuse marital tension. D. A normal developmental phase in adolescence. Answer C. A way to triangulate the parents and diffuse marital tension. This question assesses your understanding of family systems theory, specifically the concept of triangulation. The key phrase temporarily shifts the parents' focus from their conflict to managing the child's behavior indicates that the child's behavior is serving to detour the marital conflict. Triangulation occurs when a third party, often a childee, is drawn into the dyadic conflict between two others, the parents, reducing the tension between the original two but creating problems for the third. For instance, rather than directly addressing their marital issues, the parents unite in concern or frustration over the child's acting out. Remember, in family systems, the identified patient's symptoms often serve a function within the larger family system, even if unconsciously. Question 6. A new counselor, still under supervision, finds a previous client from their practicum site has sent them a friend request on a personal social media platform. The client also messaged the counselor expressing appreciation for their help and inviting them to connect. What is the most ethical course of action for the counselor? A. Accept the friend request and thank the client for their kind words, maintaining a friendly but professional online presence. B. Ignore the friend request and message to avoid any potential ethical complications. C. Decline the friend request and inform the client, either directly or through the practicum site, about ethical boundaries regarding social media. D. Accept the friend request, but set privacy settings to limit the client's access to personal information. Answer: C. Decline the friend request and inform the client, either directly or through the practicum site, about ethical boundaries regarding social media. This question tests your knowledge of ethical boundaries, especially concerning technology and social media in counseling. The keywords previous client, friend request on a personal social media platform, and ethical course of action highlight the importance of maintaining professional boundaries. Accepting a friend request from a client, past or present, on a personal social media platform blurs professional boundaries, risks dual relationships, compromises client confidentiality, and potentially exposes personal information. The most ethical response is to decline the request and, if appropriate, gently explain the professional boundaries to the client, reinforcing the importance of maintaining a professional relationship. For example, a counselor might send a brief, professional message stating that ethical guidelines prevent them from connecting on social media but reiterating appreciation for the client's kind words. Always prioritize protecting the professional relationship and client welfare by upholding clear boundaries. Question 7. A counselor is working with a client who has experienced a traumatic event. The client reports flashbacks, nightmares, hypervigilance, and avoids any reminders of the event. These symptoms began immediately after the trauma but have persisted for only 2 weeks. Based on this information, which of the following is the most appropriate provisional diagnosis? A. Post-traumatic stress disorder, PTSD. B. Acute stress disorder. C. Adjustment disorder with disturbance of conduct. D. Generalized anxiety disorder. Answer: B. Acute stress disorder. This question assesses your ability to differentiate between stress-related disorders based on symptom duration, a crucial component of DSM-5-TR diagnostic criteria. The keywords flashbacks, nightmares, hypervigilance, and avoids any reminders strongly suggest a trauma-related diagnosis, but the critical clue is that these symptoms have persisted for only 2 weeks. Acute stress disorder is characterized by a similar constellation of symptoms to PTSD but occurs within 1 month of the traumatic event and resolves within that time frame. If the symptoms were present for more than 1 month, PTSD would be considered. For instance, if the client experienced a car accident and then had these symptoms for 3 weeks, acute stress disorder is the fit. Remember, symptom duration is a key differentiator between acute stress disorder and PTSD. Question 8. During a supervision session, a supervisee expresses frustration with a client who consistently challenges their interpretations and resists homework assignments. The supervisee feels personally inadequate and is considering referring the client. The supervisor recognizes that the supervisee might be experiencing countertransference. Which supervisor response best addresses this situation from a psychodynamic perspective? A. It sounds like this client is being very difficult. Perhaps a different therapeutic approach would be more effective. B. Let's explore your feelings about being challenged and how they might be influenced by your own past experiences or relationships. C. Have you tried setting clearer boundaries and consequences for the client's resistance? D. Tell me more about the client's presenting issues. Maybe we're missing something in their diagnosis. Answer B. Let's explore your feelings about being challenged and how they might be influenced by your own past experiences or relationships. This question targets the concept of countertransference within a supervision context, specifically from a psychodynamic lens. The keywords supervisee expresses frustration, feels personally inadequate, considering referring, and the supervisor's recognition of countertransference are critical. Countertransference refers to the therapist's emotional reaction to a client, which may be influenced by the therapist's own personal history and unresolved issues. From a psychodynamic perspective, exploring the supervisee's internal emotional reactions and how their past might be influencing their present response to the client is the most appropriate way to address countertransference. For example, if the supervisee has a history of being undermined, they might overreact to a client's challenges. The goal is to help the supervisee gain self-awareness and manage their reactions effectively, not simply to change techniques or refer the client. Question 9. A school counselor is informed by a 15-year-old student that their best friend, also 15, has been posting concerning messages on social media, including statements about feeling worthless and references to ending it all. The friend has also been giving away prized possessions. The student reporting this information insists that the counselor promise not to tell anyone, as it would betray their friend. What is the counselor's most immediate and ethical course of action? A. Assure the reporting student of confidentiality and then encourage them to talk to their friend again. B. Respect the reporting student's request for confidentiality while observing the friend's behavior more closely. C. Immediately assess the friend's risk of suicide and notify parents/guardians and relevant school personnel, explaining the limits of confidentiality to the reporting student. D. Contact the friend directly and schedule a confidential meeting to discuss their social media posts. Answer C. Immediately assess the friend's risk of suicide and notify parents/guardians and relevant school personnel, explaining the limits of confidentiality to the reporting student. This question presents a high-stakes ethical dilemma involving confidentiality, duty to protect, and working with minors in a school setting. The keywords concerning messages, about feeling worthless and references to ending it all, giving away prized possessions, and the client being 15-year-old immediately trigger the duty to protect from self-harm. When a minor is at risk, confidentiality is limited, and the primary ethical and legal responsibility is to ensure their safety. This often means breaking confidentiality to involve parents/guardians and school administration, even if the reporting student insists otherwise. For example, a counselor would immediately seek out the friend, conduct a risk assessment, and then, based on that assessment, inform necessary parties while explaining to the reporting student that safety is paramount. Always prioritize the safety of a minor when there's a credible threat of harm. Question 10. A seasoned counselor is asked to provide supervision for a new intern. The intern practices from a cognitive behavioral therapy, CBT, orientation, while the supervisor primarily uses a psychodynamic approach. To ensure effective and ethical supervision, what is the supervisor's best approach regarding theoretical orientation? A. Insist that the intern adopt a psychodynamic framework to align with the supervisor's expertise. B. Encourage the intern to explore their CBT cases through a psychodynamic lens to broaden their perspective. C. Support the intern in developing their skills within their chosen CBT orientation, while offering insights from different perspectives as appropriate. D. Focus solely on ethical and legal issues, avoiding discussion of theoretical approaches where differences exist. Answer C. Support the intern in developing their skills within their chosen CBT orientation, while offering insights from different perspectives as appropriate. This question addresses ethical and effective supervision practices, particularly regarding theoretical orientation. The keywords new intern, CBT orientation, and supervisor primarily uses a psychodynamic approach highlight a potential difference in theoretical perspectives. An ethical supervisor supports the supervisee's development within their chosen theoretical framework, helping them refine their skills and understanding of that approach. While it is beneficial to expose supervisors to different perspectives and broaden their conceptualizations, the supervisor should not impose their own theoretical orientation. For example, the supervisor could help the CBT-oriented intern refine their cognitive restructuring techniques while also discussing how early relational patterns might influence a client's core beliefs. Effective supervision respects the supervisee's developing identity while offering expansive learning opportunities. Question 11. A counselor is developing a new group therapy program for individuals recovering from substance use disorders. When considering the ethical implications of advertising and recruitment for this group, which of the following actions is most ethically sound? A. Advertise the group as guaranteed recovery to attract more participants who are desperate for help. B. Use testimonials from former clients in the group's promotional materials, with their written consent. C. Clearly state the group's purpose, format, and potential risks, ensuring informed consent is obtained before participation. D. Limit participation to individuals of a specific socioeconomic status to ensure group homogeneity. Answer: C. Clearly state the group's purpose, format, and potential risks, ensuring informed consent is obtained before participation. This question focuses on ethical considerations in group counseling, particularly regarding advertising, recruitment, and informed consent. The keywords ethical implications, advertising and recruitment, and group therapy program point to the fundamental requirement of transparency and client protection. Providing clear and accurate information about the group's purpose, format, fees, and potential risks allows potential participants to make an informed decision about joining, which is a cornerstone of ethical practice. For example, counselors should explain what happens in the group, the time commitment, and any potential emotional challenges. Avoid making exaggerated claims or using testimonials that could be seen as coercive or misleading, and ensure accessibility for all who could benefit, regardless of socioeconomic status. Question 12. A client diagnosed with borderline personality disorder frequently calls their counselor between sessions, often reporting new crises or intense emotional distress, demanding immediate attention. The counselor feels overwhelmed and drained by these calls but also fears the client may decompensate without constant reassurance. Which of the following is the most appropriate boundary-setting strategy for the counselor to implement? A. Immediately terminate counseling due to the client's excessive demands. B. Block the client's number and inform them at the next session that calls are not permitted. C. Collaborate with the client to establish clear communication guidelines for between-session contact, including specific times or methods for reaching out, while also exploring the client's need for constant reassurance. D. Allow the calls to continue, but bill the client for all time spent on the phone, as it constitutes therapeutic work. Answer: C. Collaborate with the client to establish clear communication guidelines for between-session contact, including specific times or methods for reaching out, while also exploring the client's need for constant reassurance. This question addresses the critical need for boundary setting, particularly with clients who struggle with emotional regulation and attachment issues, like those with borderline personality disorder. The keywords frequently calls, demanding immediate attention, overwhelmed and drained, and fears the client may decompensate highlight a boundary violation impacting both client care and counselor well-being. The most appropriate strategy is to collaboratively establish clear, consistent boundaries regarding communication, as this teaches the client self-regulation and healthy relational patterns within the safety of the therapeutic relationship, while also exploring the underlying needs driving the behavior. For example, the counselor might set up designated brief check-in times or provide specific resources for crisis situations, rather than being available 24/7. This approach promotes the client's growth within structured limits, which is vital for this population. Question 13. A research study aims to evaluate the effectiveness of a new trauma-focused intervention. Participants are randomly assigned to either the experimental group, receiving the new intervention, or the control group, receiving standard care. The researchers plan to measure symptom reduction using a validated assessment tool before and after the intervention. Which type of research design is being utilized? A. Correlational design. B. Quasi-experimental design. C. Single-subject design. D. True experimental design. Answer: D. True experimental design. This question tests your understanding of research methodologies, specifically identifying different research designs. The key phrases "participants are randomly assigned" and "experimental group, control group" are definitive indicators of a true experimental design. Random assignment is the hallmark of a true experiment, as it helps ensure that the groups are equivalent at the start, increasing confidence that any observed differences in outcomes are due to the intervention and not other factors. For example, if you wanted to see if a new drug works, you would randomly assign people to either get the drug or a placebo. Remember, random assignment to experimental and control groups is what distinguishes a true experiment. Question 14. A client, who is a recent immigrant, reports significant challenges adjusting to their new cultural environment, including feelings of isolation, language barriers, and discrimination. The counselor, who shares the client's cultural background, feels a strong sense of empathy and a desire to personally help the client navigate these challenges beyond the scope of traditional therapy, such as offering to assist with job applications or housing searches. What is the most ethically appropriate response for the counselor? A. Provide the requested personal assistance, as sharing a cultural background mitigates the risks of a dual relationship and promotes trust. B. Refer the client to community resources and support networks that can provide practical assistance, while continuing to address their emotional and psychological adjustment in counseling. C. Gently explain that the counselor's role is strictly limited to emotional support and cannot extend to practical, tangible aid. D. Consult with a supervisor about developing a new, culturally sensitive program that explicitly includes practical assistance for immigrant clients. Answer: B. Refer the client to community resources and support networks that can provide practical assistance, while continuing to address their emotional and psychological adjustment in counseling. This question addresses ethical boundaries and multicultural competence, particularly when a counselor identifies with a client's cultural background and is moved to offer practical, non-counseling assistance. The keywords recent immigrant, challenges adjusting, shared cultural background, desire to personally help, beyond the scope of traditional therapy, and ethically appropriate response highlight the potential for dual relationships and the importance of maintaining professional boundaries while still being culturally responsive. The most ethical approach is to recognize the client's comprehensive needs and use the counselor's expertise to connect the client with appropriate community resources for practical help, while keeping the therapeutic focus on emotional and psychological adjustment. For instance, a counselor might say, "While I can't directly help with your job search as your counselor, I know of several excellent organizations that specialize in helping new immigrants find employment, and I can provide you with their contact information." This maintains professional boundaries while still offering culturally sensitive support. Question 15. A counselor is working with a client who is mandated to attend counseling as a condition of their probation. The client frequently expresses resentment about being forced to attend and is generally unmotivated. From a motivational interviewing (MI) perspective, what is the counselor's most effective initial approach? A. Confront the client directly about their resistance and explain the consequences of noncompliance. B. Emphasize the importance of following probation terms to avoid legal repercussions. C. Explore the client's ambivalence about change, listening for change talk and reinforcing any statements indicating a desire for a different future. D. Focus on psychoeducation, explaining the benefits of counseling and self-improvement. Answer: C. Explore the client's ambivalence about change, listening for change talk and reinforcing any statements indicating a desire for a different future. This question tests your understanding of motivational interviewing, MI, particularly when working with a resistant or mandated client. The keywords "mandated to attend," "frequently expresses resentment," and "generally unmotivated" describe a client who would likely benefit from MI. MI's core principle is to explore and resolve ambivalence, recognizing that resistance is often a normal part of the change process. Rather than confronting or persuading, the counselor should empathetically listen for change talk, any statements from the client expressing desire, ability, reasons, or need for change, and reinforce these. For example, if the client says, "I hate being here, but I guess I also don't want to go back to jail," the counselor would reflect and affirm the desire not to return to jail. The goal is to evoke the client's own motivation for change, not to impose it. Question 16. A client in long-term therapy suddenly begins missing sessions, becoming withdrawn, and reports feeling overwhelmed by the therapeutic process. The counselor notes that these behaviors coincide with an upcoming discussion about the client's traumatic childhood experiences. From a psychodynamic perspective, how might the counselor best understand this client's behavior? A. The client is likely experiencing external stressors unrelated to therapy. B. The client is consciously trying to manipulate the therapeutic process. C. The client is engaging in resistance as a defense mechanism to avoid painful unconscious material. D. The client requires a change in therapeutic modality, as the current approach is ineffective. Answer: C. The client is engaging in resistance as a defense mechanism to avoid painful unconscious material. This question assesses your grasp of key psychodynamic concepts, specifically resistance. The keywords "suddenly begins missing sessions," "withdrawn," "overwhelmed by the therapeutic process," and "coincide with an upcoming discussion about the client's traumatic childhood experiences" strongly indicate resistance. In psychodynamic theory, resistance refers to any conscious or unconscious behavior that impedes the progress of therapy or keeps unconscious material from becoming conscious. It is often seen as a defense mechanism to protect the ego from painful or anxiety-provoking thoughts, feelings, or memories. For example, a client might forget an appointment just before a session where they were planning to discuss a difficult topic. Understanding resistance as a sign that important material is surfacing allows the counselor to approach it with curiosity and empathy, rather than judgment. Question 17. A counselor receives a subpoena for a client's records. The subpoena was issued by an attorney involved in a civil lawsuit against the client. The client has not provided consent for the release of their records. What is the counselor's most appropriate immediate action? A. Immediately release the records as mandated by the subpoena. B. Contact the attorney who issued the subpoena to explain the limits of confidentiality. C. Assert privilege and contact the client to discuss the subpoena and their preferences, potentially seeking legal counsel. D. Destroy the relevant portions of the records to protect client privacy. Answer: C. Assert privilege and contact the client to discuss the subpoena and their preferences, potentially seeking legal counsel. This question tests your knowledge of legal and ethical responsibilities concerning client records and subpoenas, specifically the concept of privileged communication. The keywords "subpoena for a client's records," "civil lawsuit," and client has not provided consent are crucial. A subpoena alone does not automatically override client confidentiality and privilege. The counselor's primary duty is to protect the client's privacy. Therefore, the counselor must assert privilege, meaning they inform the court or requesting party that the records are confidential and subject to privilege, and then immediately contact the client to discuss the subpoena, their rights, and preferences regarding disclosure. For example, the counselor would explain the situation to the client, discuss the implications of releasing records, and explore options like having the client's attorney quash the subpoena. Always prioritize the client's right to privacy and seek legal guidance when uncertain. Question 18. A high school student expresses distress to the career counselor, stating, "My parents expect me to become a doctor, but I really want to pursue a career in graphic design. I feel torn and don't know what to do." From a career counseling perspective using Super's lifespan, life space theory, what concept is this student primarily struggling with? A. Career adaptability. B. Role salience. C. Self-concept crystallization. D. Vocational maturity. Answer: C. Self-concept crystallization. This question assesses your understanding of Donald Super's lifespan, life space theory of career development. The keywords "parents expect me to become a doctor," "I really want to pursue a career in graphic design," and "I feel torn and don't know what to do" describe a conflict between internal desires and external expectations regarding career identity. This directly relates to self-concept crystallization, a stage in Super's theory where individuals integrate their self-concept, interests, values, abilities, with their understanding of different occupational roles. The student is struggling to form a clear and consistent sense of vocational identity because of conflicting internal and external pressures. For example, a student who has clearly identified their skills and passions and found a career path that aligns with them would have achieved crystallization. The takeaway is that Super emphasized the importance of integrating one's self-concept into career choices. Question 19. A counselor is conducting a mental status examination, MSE, with a new client. When assessing the client's effect, what specific aspect of their emotional presentation is the counselor primarily observing? A. The client's self-reported mood, such as sad or happy. B. The client's long-term emotional disposition or personality traits. C. The observable, external expression of the client's emotional state. D. The client's cognitive understanding of their current emotional experience. Answer: C. The observable, external expression of the client's emotional state. This question tests your foundational knowledge of the mental status examination, MSE, specifically the distinction between mood and affect. The keyword affect in the context of an MSE refers to the observable, external expression of a client's current emotional state. This is different from mood, which is the client's subjective, self-reported emotional state. For example, a client might report their mood is depressed, but their affect might be described as flat, constricted, or congruent with their mood if they appear sad and tearful. Counselors observe qualities like the range, intensity, appropriateness, and stability of affect. Remember, mood is internal and subjective, how do you feel, while affect is external and objective, how do you look like you're feeling? Question 20. A counselor working in a community agency receives a gift from a client at the termination of counseling. The gift is a hand-knitted scarf, which the client spent many hours creating and expresses is a token of their deep appreciation. The agency policy discourages accepting gifts of significant monetary value but is less clear on handmade items. What is the most ethically informed decision for the counselor? A. Decline the gift, explaining that agency policy prohibits accepting any gifts. B. Accept the scarf graciously, as declining it might offend the client and harm their therapeutic gains. C. Accept the gift, but consult with a supervisor to discuss the ethical implications and document the decision. D. Advise the client to donate the scarf to a local charity instead. Answer: C. Accept the gift, but consult with a supervisor to discuss the ethical implications and document the decision. This question presents a common ethical dilemma regarding accepting gifts from clients, especially at termination. The keywords gift from a client, hand-knitted scarf, token of their deep appreciation, and agency policy discourages accepting gifts of significant monetary value but is less clear on handmade items highlight the nuance. While outright declining could damage the therapeutic relationship, blindly accepting without consideration can blur boundaries. The most ethically informed decision is to accept the gift graciously, acknowledging the client's sentiment, but then immediately consult with a supervisor to discuss the ethical implications. This allows for peer guidance, ensures appropriate documentation, and helps the counselor navigate the boundary issue while honoring the client's gesture. For example, a supervisor might help the counselor process the meaning of the gift within the therapeutic relationship and confirm that it does not create a dual relationship or exploit the client. Always consult and document when navigating ambiguous ethical situations. Question 21. A counselor is facilitating a grief support group. During one session, a new member begins to share intensely personal and graphic details of their loved one's death, which several other group members appear visibly distressed by, with some beginning to tear up or avert their gaze. What is the most appropriate action for the group leader? A. Allow the member to continue sharing to fully process their experience, as emotional expression is vital in grief work. B. Gently interrupt the member, acknowledge their pain, and redirect the focus to the impact of the loss, while reminding the group about establishing a safe space. C. Suggest the distressed members take a break outside the room until the sharing is complete. D. Advise the member to share less intensely next time, as it is upsetting others. Answer: B. Gently interrupt the member, acknowledge their pain, and redirect the focus to the impact of the loss, while reminding the group about establishing a safe space. This question assesses your ability to manage group dynamics and maintain a safe therapeutic environment, particularly in a sensitive context like a grief support group. The keywords intensely personal and graphic details, several other group members appear visibly distressed, and most appropriate action indicate a need for immediate intervention to protect the group. While emotional expression is important, graphic details can be overwhelming and re-traumatizing for others. The most appropriate action is to gently interrupt, validate the speaker's pain, and then skillfully redirect the sharing to focus on the emotional impact and meaning of the loss, rather than explicit details, while also reinforcing the group's role in creating a safe and supportive space for all. For example, you might say, "Thank you for sharing such a painful experience, and it's clear how much this means to you. For the safety of everyone here, let's keep the focus on the feelings and impact of the loss, rather than the graphic details, so we can all support each other." This balances individual expression with group safety. Question 22. A couple seeking counseling reports constant conflict, blame, and a feeling of disconnect. The wife states, "He never listens to me," while the husband counters, "She's always nagging me." A structural family therapist would likely view this couple's interactional pattern as indicative of what? A. Enmeshed boundaries. B. Disengaged boundaries. C. A rigid power hierarchy. D. A negative feedback loop. Answer: D. A negative feedback loop. This question tests your understanding of core concepts in family systems therapy, particularly structural family therapy. The keywords constant conflict, blame, and a feeling of disconnect, along with the reciprocal complaints, "He never listens," "She's always nagging," are classic descriptors of a negative feedback loop. In systems theory, a negative feedback loop maintains the status quo within a system. In this case, the more one partner nags, the more the other withdraws, which then leads to more nagging, perpetuating the problem. This circular causality keeps the system stuck in a dysfunctional pattern. For example, if one partner tries to solve a problem by yelling, and the other responds by shutting down, and this cycle repeats, it's a negative feedback loop. Understanding these patterns helps therapists intervene to disrupt them and create healthier interactional sequences. Question 23. A counselor is reviewing the treatment plan for a client diagnosed with major depressive disorder who has shown minimal improvement after several weeks of cognitive behavioral therapy, CBT. The client reports adhering to all homework assignments but still feels profoundly sad and anhedonic. The counselor is considering additional or alternative interventions. Which of the following is the most appropriate next step from an integrated care perspective? A. Increase the frequency of CBT sessions to daily. B. Refer the client for a psychiatric evaluation to explore psychopharmacological options. C. Recommend the client try a different counseling theory, such as psychodynamic therapy. D. Terminate counseling, as CBT is not effective for this client. Answer: B. Refer the client for a psychiatric evaluation to explore psychopharmacological options. This question focuses on integrated care and treatment planning for clients with persistent symptoms. The keywords major depressive disorder, minimal improvement after several weeks of CBT, adhering to all homework, and profoundly sad and anhedonic suggest that the client may benefit from a multimodal approach. When a client shows limited progress despite engaging in a well-established therapeutic modality like CBT for depression, it's appropriate to consider adjunct treatments. Referring for a psychiatric evaluation to explore psychopharmacological options is a key component of integrated care, recognizing that biological factors can play a significant role in depression and medication can often enhance the effectiveness of psychotherapy. For instance, if therapy alone isn't shifting severe depression, medication might help stabilize mood enough for therapy to become more effective. Always consider a holistic approach and collaboration with other professionals when initial interventions prove insufficient. Question 24. A counselor working in a private practice is asked by a former client, who terminated therapy 2 years ago, to write a letter of recommendation for their application to graduate school. The former client was successful in therapy and now needs an academic reference. What is the most ethically sound course of action for the counselor? A. Write the letter of recommendation, as the therapeutic relationship has officially ended, and the client was successful. B. Decline to write the letter, citing the ethical prohibition against dual relationships. C. Write a letter that addresses the client's personal growth and resilience observed in therapy, but explicitly states that it is not an academic reference. D. Consult with a supervisor or ethical committee regarding the request and decide based on the specific circumstances and ethical guidelines. Answer: D. Consult with a supervisor or ethical committee regarding the request and decide based on the specific circumstances and ethical guidelines. This question delves into a nuanced ethical dilemma concerning dual relationships and the professional role of a counselor. The keywords former client, terminated therapy 2 years ago, letter of recommendation for their application to graduate school, and academic reference indicate a potential blurring of professional boundaries. While the therapeutic relationship has ended, acting as an academic reference creates a new, non-therapeutic relationship that can still be ethically problematic due to the power differential and the inherent advocacy involved. The most ethically sound approach is to consult with a supervisor or ethical committee. This allows for an objective assessment of the potential risks and benefits, considers the specific context, e.g., duration since termination, nature of therapy, and ensures the decision aligns with professional standards, which is always recommended for ambiguous boundary issues. It's crucial to evaluate if the new role could compromise objectivity or exploit the former therapeutic relationship, even indirectly. Question 25. A new client presents to counseling expressing profound feelings of worthlessness, guilt, and a lack of motivation. The client admits to recently experiencing hallucinations, specifically hearing voices telling them they are evil and don't deserve to live. They also report disorganized thinking and occasional delusional beliefs about being targeted by a secret organization. The counselor's immediate priority should be to A. Begin cognitive restructuring techniques to challenge the client's negative thought patterns. B. Focus on developing rapport and establishing a therapeutic alliance before addressing severe symptoms. C. Conduct a thorough risk assessment, particularly for suicidality, and refer for psychiatric evaluation. D. Explore the potential origins of the client's worthlessness and guilt through psychodynamic techniques. Answer: C. Conduct a thorough risk assessment, particularly for suicidality, and refer for psychiatric evaluation. This question prioritizes safety and appropriate scope of practice, especially when dealing with severe mental health symptoms. The keywords profound feelings of worthlessness, guilt, hearing voices telling them they are evil and don't deserve to live, disorganized thinking, and delusional beliefs strongly indicate the presence of psychotic symptoms and a high risk for self-harm. In such a scenario, the counselor's immediate and primary responsibility is to ensure the client's safety by conducting a thorough risk assessment for suicidality or harm to others, and then referring for an immediate psychiatric evaluation to determine the need for medication and a higher level of care. While building rapport and addressing thought patterns are important, these take a secondary role when acute psychosis and safety risks are present. Always prioritize safety and appropriate medical/psychiatric intervention when dealing with psychosis and potential for harm.